Hi, I'm Dr. Schwartz, and I want to welcome you and thank you for joining us today. Today we're going to demonstrate a treatment with Kybella, and we have the lovely Vanessa here who's been happy to help us with this. Now, Kybella is a new treatment that's used to remove fat deposits that develop under the chin, or what's sometimes known as the double chin around here. So, Vanessa is a wonderful patient for this. As you can see from her original picture, she has this little development under here. And this is the exact perfect situation for Kybella. This treatment allows us in the office to inject this medication, and over a series of treatments over several months it will dissolve this and get rid of it without any surgery. Now, our lovely Vanessa here has a little bit. She's actually already had one treatment, which was about 6 weeks ago, and she's had some improvement there. We can look at her picture before and now, and she's going to have her second treatment, which is average for this amount of fat deposit. So we're hoping that this second treatment will do it for her. She may need a third, but that's normal, and this is what we'll do. Vanessa, maybe you might want to tell us about your first treatment. Did you find it very painful or uncomfortable? I know there was some swelling as expected and irritation, but...
There was it was regular inflammation, but there wasn't any pain, and I normally don't like needles, but it was very well. It was definitely something that can be handled in office procedure.
Okay, so we start the procedure by marking the patient because there are specific zones that we want this medicine to be injected to and others that don't. So we want to identify the area that we actually want to treat and the areas we don't. So I'm going to start with the red marker for areas that we don't want to treat, and I'm going to mark out Vanessa's jawline. We don't want to inject into the jawline because there are nerves there. We're going to mark out where what sternomastoid muscle is here, and the other one on this side here. And we're going to mark out the lower extent down below where we get to her voice box here. Then the next area we're going to mark it at the border. We're going to say, can you grimace? Can you show us your bottom teeth? We want to see if she has what are called platysma muscle bands, which she does not, but you can relax now. But we know that the platysma muscle will come this way from the jaw down across the sternomastoid muscle there. So those are areas from those red lines and out that we don't want to put our medicine in, with the green marker. And so what we do know is we're going to pinch this area here. We feel a little bit of fat, so we're going to mark with the green from this border underneath here and down to about here and here, and stay out of that area there. And this zone is also okay out to that border, but we're going to just concentrate on those areas, and if we keep the medicine in there, she should have very little pain or discomfort afterwards or any other untoward effects, and she'll get the maximum effect on dissolving the fat in that area. To assist us further, we're going to put a marking grid on her. So to assist us further, we've used this marking grid, which comes with our Kybella treatment, and we put that on there. And this area here shows us with these little dots each area that we want to inject, so we have an overlapping area of the medication to get maximal treatment. We've pre-marked her, as we said, with our red lines. Some of them seem to have disappeared, which show us where we don't want to go in this area for Vanessa. So we know by following the grids dots that are within there, that's where we want to stay. I'm going to make Vanessa lie back, have Vanessa lie back a little bit. That's local. I very much want Vanessa and all patients to have a painless experience. So we're going to start out by injecting a little numbing medication. And that will hopefully give her a little bit of anesthesia for it, because the Kybella can be a little bit irritating. You doing okay?
Mhm.
This is not like a local block like when you go to the dentist where your entire face or neck or chin will be numb, but it will be enough just to take the edge off so that there's no stinging when we actually do the Kybella. And I'm just injecting just below the skin here to this area. Okay. Let's give that a rest for a minute. Okay, so we're ready to start our treatment now. We've given Vanessa a few minutes to have some numbing. And again, as to repeat, we've marked our areas with our grids. And the way we use the Kybella or administer it is that we want to put overlapping sections so that we spread the medicine out evenly so that we get the maximum effect. So we're going to start on the middle, at least that's the way I like to start, and work my way out a little bit. And what I'll do is sort of squeeze it a little bit so I feel the fat, and we'll sort of gently make sure I feel myself go in and beyond it. We'll put our first little bit, and then to the next dot, and the second little bit, and then the next dot, to the third little bit, and then I'll go down to the next row here, and again, a little bit, and then again, a little bit, and once more, and down once more here. Okay, so the next syringe. Now Vanessa's going to be receiving 2 vials today, which is sort of a common dose. So it may seem like this is a lot, but this is kind of an average treatment. So we've done that side. I'm going to work towards the other side. And very important that we get through the skin. We don't want to put the Kybella into the skin because that's not where its action is. Its action is going to be beneath it in the fat. Maybe when I come over here, people will be able to see it a little bit better. How you doing, Vanessa?
Good.
Is it painful?
Just a little stinging.
A little stinging, okay. We're just about done here. The medicine will sting as it goes in because that's some of the nature of its effect. So we are trying to move along and just get it in, and that way we'll then be able to just give her a little ice to put on it and be done. And actually we were able to cover that whole area and we didn't need to use a full 2 vials, and that takes care of it. So we're going to get her some ice and we're going to wipe off these markings. Now we're going to expect for her to get some swelling later today and tomorrow and get some firmness under there and some sensitivity. And the worst of that will be over the next couple of days, but then it will subside as time goes on. And hopefully by our next session in about 6 weeks or so, the majority of the fat will be gone by then. And if we have to do a little bit of a touch-up, then we will. You're supposed to wipe it with this, right?
Mm-hmm.
Okay. That, and we're going to try and wipe that off with some majority of the fat will be gone, and we may not need another session, but if we do, we will. Vanessa will be asked not to do any heavy exercise or be in the sun for the next couple of days, but other than that, she'll be able to eat and drink whatever she likes. She'll be able to put makeup on if she wishes. She'll be able to do any normal activities that she normally would do. There we go. And that's how we do a Kybella treatment.